Good afternoon, everyone. You're welcome to the FAJIM Health Discourse, which is the first in its series. FAJIM Medicare Foundation is a non-profit and non-political, non-religious organization founded and registered with CAC in 2018. The aim is to improve the health status of Nigerians through health education, screening for early detection of diseases, and promotion of preventive healthcare programs. This lecture is part of our activities to give health education to the public with emphasis on prevention. The topic to be discussed is titled Medical Benefits of Ramadan Fast, to be taken by Professor Simiat Elias. This will be followed by a short talk by Professor Fatimah Abdulkareem, founder of FAJIM Medicare Foundation, on tips of navigating life during the COVID pandemic. Before then, a FAJIM scholar will give a brief introduction of what FAJIM is about. Questions and answers shall be taken at the end of both lectures.
Well, this is to introduce FAJIM Medicare Foundation, and this was prepared by two of our scholars. One of them is supposed to be the one to present this. I don't know what's happening that he's not able to join us. FAJIM Medicare Foundation is a non-governmental organization is non-profit making, non-religious, and was founded in 2018 with the aim of improving the health status of the underserved communities in Nigeria through health education, screening for early detection of diseases, and promotion of preventive health programs. And our slogan is, hand in hand, together we can, meaning that when we join hands with the community, with you, we can improve the health status of our country, Nigeria. We can improve the health status of Nigerians. Our vision is to be a foremost non-governmental organization committed to improving the health status of Nigerians with emphasis on the underserved. And the mission: promote preventive health through health education, encourage students to take up careers in healthcare profession by way of scholarships, and to collaborate with local and international bodies with similar objectives. Now, what are our focus? We focus our activities on three major areas. One is health education, which is one of what we are doing today. Two is screening for common communicable diseases through medical outreach. We go out to villages and the underserved areas. We screen them and treat them for common ailments, and then we give scholarship grant. The first set of students were awarded scholarship, 14 of them last year, all in various universities in the Southwest. And what have we achieved within just about one and a half years? We've been able to establish a wellness center at Igbora, where we have a nurse that does free screening for people in the community. We have also had the public launch and presentation of the foundation, where we gave out a scholarship to 14 medical undergraduates, where each of them were awarded 100,000 to take care of their academic needs. And then we have been going around to give health education, free medical screening, and we've done this for over 1,500 persons. And we have also donated drugs to Medical Students Association during their outreach. And this pictures of some of the things that we've done. You know, this is the FAJIM Wellness Center at Igbora. See the nurse taking blood pressure of that. We had World Health, we commemorated World Health, World Cancer Day earlier this year. We were at Ojagba in Igbora to do screening. During one of the, during that, I was there giving lectures. We even talked about Lassa fever, COVID. COVID was just coming up at that time. We didn't have any patients in Nigeria at that time. And we had drugs, free drugs that we gave away to people. And then the last picture there, that's where FAJIM was being launched publicly, and we had several dignitaries there. At that ceremony too, we had scholars that were giving, they were there taking pictures with our role model, Professor Folashade Ogunshola. So my scholar concluded and say it is true that a journey of 1,000 miles starts with a step. Yes, we have started and nothing is stopping us. Thank you.
Much, Ma. That was the founder of FAJIM Medicare Foundation, giving us a brief introduction into what FAJIM Medicare is about and what we have been up to. The next on the agenda is the lecture. Is a lecture by Dr. Simiat Elias. Dr. Simiat Elias is an Associate Professor of Physiology with the Lagos State University College of Medicine, Nigeria. She is a member of many professional associations, including Nigerian Medical Association, Physiological Society of Nigeria, Medical Women Association of Nigeria, American Physiological Society, the Physiological Society, United Kingdom, and the International Association of Medical Science Educators, and the Islamic Medical Association, IMAN. Simiat is currently an elected member representing Africa on the board of General Assembly of International Union of Physiological Societies, IUPS. She is also a pioneer member of the Criterion and Association of Muslim Women in Business and the Professions. Simiat Elias is happily married to Surveyor Hassan Elias, and the marriage is blessed with a wonderful daughter and grandchildren. Simiat loves reading and giving motivational talks. She also engages in charity work with a passion for women issues and orphans, for which she finds a good platform in the Criterion. You're welcome, Ma.
I'd like to thank the FAJIM Medicare Foundation for inviting me to be part of this discourse. May Allah subhanahu wa ta'ala make this serve as Sadaqah to Jariyah, that is unending Sadaqah for the owners of the foundation and for those of us who support them. I'll be speaking on the medical benefits of Ramadan, but I need to explain what Sadaqah to Jariyah means for those who may not understand. That is unending Sadaqah. Our beloved Prophet Muhammad ﷺ said that after the death of a person, only 3 things will continue to serve as a source of blessing to him or her. The first being knowledge that he or she had taught to someone and from which humanity continues to benefit. Sadaqah that he or she had done that continues to exist, such as planting a tree, building a well, or even building a school. Children that he or she had raised to be dutiful to Allah and who continue to pray for him or her after the demise. So this is a lesson to us all. What FAJIM is doing today and which they've set out to do is a lesson to us all. We are the ones who will determine how we shall be remembered. It's not the number of streets that will be named after us, but the deeds that we had actually done before we died. We pray that God Almighty will grant us many more decades in which to worship Him and to be of service to humanity. Now, why do Muslims fast in Ramadan? Allah subhanahu wa ta'ala says in the Quran, fasting has been prescribed to you, O you who believe. Fasting has been prescribed to you as it was prescribed for those before you, that you may learn self-restraint. This suggests to us that the fast of Ramadan was ordained by our Creator, Almighty Allah, so that we may become more pious. It therefore means that the fast of the believers in Ramadan is not essentially to attain better health. I do not know of anybody who fasts just for that reason. However, whereas it is for us to move closer to Allah, our Creator, there are some incidental advantages, part of which is that we'll get healthier after the 1 month fast. What are the types of fast that exist among mankind? Many religions advocate some form of fasting, either time-bound abstinence from food and drinks, or total abstinence from some particular food items for all time or for a period of time. These nutritional modifications, based on the benefits or based on the beliefs of the individuals, are largely taken for granted, with very few studies being carried out on the health benefits of such practices. Ramadan fasting provides a model for investigating dietary restriction. Because of its tolerability, it's very tolerable. A lot of people partake in Ramadan fasting without any untoward effects. And so it provides a large pool of people that can be studied for health benefits. Ramadan fasting is therefore recognized as a form of intermittent fasting. This type of fasting generally fasts, including a period of feasting and a period of fasting. The fast of Ramadan commences with a compulsory pre-dawn meal, which is called sahur, and it ends at sunset with the iftar. However, aside from abstaining from food and drink during the day, the fasting Muslim is also expected to abstain from lawful sexual intercourse with one's spouse during the period of fasting. Ramadan is therefore a month of self-regulation and self-training, with the hope that this training will last beyond the end of Ramadan. Other types of intermittent fasting do exist. The first one being the twice-a-week fasting, which we do outside Ramadan, and for Muslims, we do this on Mondays and Thursdays. There's also the alternate day fasting, like the fast of Prophet Moses, but which our beloved Prophet Muhammad also recommended to those of the Muslims who feel that they have greater capacity to fast. The third type of intermittent fasting is time-restricted fast. For example, some people will do the 16-8 fasting, which is eating between 11 a.m. and 7 p.m., or eating between noon and 8 p.m. Or some will do 14-10, in which people eat between 10 a.m. and 8 p.m. So that essentially what this time-restricted fast does is that people fast during the day, they eat during the day and fast during sleep. Who does not know that we all fast while we sleep? Nobody eats during sleep. Now, the last type of fasting that exists is the eat, stop, eat fast, also known as the 24-hour fast, in which the fasters fast entire 24-hour periods, and then they eat for the next 24 hours, and then they fast again for the next 24 hours without taking any food or drink. I hope you can still hear me. Can you still hear me, please?
Yes, ma'am. Yes, ma'am.
All right. So how does the Ramadan fast contribute to health? According to the World Health Organization, health is defined as a state of complete physical, mental, and social well-being, not just a state of no disease or infirmity. But because this definition, which was crafted in 1948, appeared to give some people some distress in that they try to ensure they don't have any infirmity and they don't have any disease, and that's all they do with their time, WHO has gone on to modify this definition to state that health is a resource for everyday life and should not be the object of living. So we're not here just to watch our health, we're here to use our health as a resource, something that we use to enjoy our lives. So fasting in general has been used in medicine for medical reasons, such as for weight management, to rest the digestive tract, and for lowering to lower lipids. One of the earliest doctors to prescribe fasting as a form of treatment in the United States of America was Isaac Jennings. He advocated specific fasting for treatment of specific ailments as opposed to the use of drugs. Thereafter, Herbert Shelton in 1920 established the American Natural Hygiene Society to promote fasting and holistic lifestyle to the public. And later in 1978, he formed a professional body involved with research into fasting as a form of treatment. However, whereas most of these human recommended fasts are total fasts, the Ramadan fast is not. As I explained earlier, the Ramadan fast begins with sahur in the morning, just before sunrise, before Fajr, pardon me, and then ends just after sunset with iftar. Because Allah says Ramadan is not prescribed to harm us, nor is it prescribed as a form of punishment, but for us to attain Allah's rahmah. So others have engaged in crash diets with the hope of reducing their weight so that they can fit into the latest fashion. Moreover, the type of food taken during Ramadan does not have any selective criteria of the crash diets that we know, because we do not take only proteins, nor do we take only fruits. Every type of food that is permissible to the Muslim is allowed to be taken during Ramadan in moderate quantities. So what are the health benefits of Ramadan fasting? At the first international conference on health and Ramadan held in Casablanca in 1994, which was the eye-opener for researchers to realize that Ramadan fast could actually be investigated scientifically. We could look at it and see what benefits or otherwise it has on health. So during this conference that was held in Casablanca in Morocco in 1994, over 50 research papers were presented by both Muslims and non-Muslims, showing that Ramadan fasting results in improvement in many medical conditions, and that in no way did fasting in Ramadan worsen any patient's health, nor the baseline medical condition. Now, some of the things that were presented during that conference, and some of those that have been reported thereafter, are going to form the basis of my next few discourse with you. The first one is that fasting gives the body systems complete rest and improved ability to function. Normally, the digestive system works almost round the clock to break down what we eat or drink, so as to make these available for the body to use. In addition, through what we eat and drink, the body is exposed to a lot of toxins. When we fast, therefore, the gastrointestinal system rests, or the body is exposed to fewer amounts of toxins, and the body system is able to flush out residual toxins found to cause certain diseases, including cancer. So because we're no longer eating voraciously as we would outside Ramadan, and because we are allowing time between sahur and iftar, it is possible for our intestines to rest. The stomach rests, the small intestine, the large intestine, everything rests. And therefore, this gives time for our body cells, millions and millions of our body cells, to rest, rejuvenate, and revive. Secondly, fasting in Ramadan encourages us to eat a balanced diet. And we all know the importance of eating a balanced diet. They must be part of the meals that we eat, must contain carbohydrate, proteins, fats, minerals, and vitamins. And of course, raw veggies, which we can get from vegetables and we can get from fruits. Now, to begin fasting, we are encouraged to eat a good meal before Fajr. That's before, well, Fajr. The Prophet ﷺ said that the sahur that we eat is a blessed meal. Do not neglect it, even if it is a mouthful of drink. For Allah and the angels bless those who observe it. That is, who eats the sahur. So for the Muslims fast, we must always wake up to eat something, even if it's just going to be a drink. And this is part of the blessings of Ramadan. Now, another training in Ramadan is the iftar. We are encouraged to use fruits as the first food that we'll eat when we want to break our fast. The Holy Prophet ﷺ used to encourage us to break our fast with dates or any fruit or water because these are pure. And it's been proven, most of us, well, some of us who are scientifically oriented know that eating fruits on an empty stomach allows the fruits to work as antioxidants as well as to remove toxins more than they would have worked if we had eaten the fruits after having had a full meal. So by the Ramadan fast, by the fact that we eat a good meal or good meals in Ramadan, malnutrition is prevented or reduced, as most families endeavor to prepare special meals in a way to include food from the different food groups I mentioned earlier. Moderation is also practiced. It must be pointed out that to fully benefit health-wise from the Ramadan fast, we must desist from the temptation to fill up our stomachs, because if we do this as if we're making up for the lost lunch, then we would have defied the aim of Ramadan, which is to teach us self-restraint. Besides, we should remember that the Prophet ﷺ taught us regarding eating. He said, "The son of Adam does not fill any vessel worse than his stomach. It is enough for the son of Adam to eat a few mouthfuls to straighten his back, but if he must fill his stomach, then he should fill 1/3 with food, 1/3 with his drink, and 1/3 with air to allow him to breathe." So Muslims are not encouraged to eat their fill at any time, and certainly not in Ramadan. When the stomach is overfilled, it leads to indigestion, acid reflux, and sometimes constipation. The individual is unable to carry out his or her usual normal activities, and this does defeat the purpose, I am sure. So some people eat till they suffer from food coma. They eat and eat and eat, and they can no longer eat. And at the end of this gorging, they become so lethargic, all they want to do is sleep. The GI tract has to find energy to deal with the food that we eat. And when we overeat, it's going to get energy from elsewhere to digest the food and to absorb the food. And this is what leads to the tiredness that these individuals feel. So the Ramadan fast cures us of this, as long as we realize that we are not supposed to use iftar, that's the evening meal, to make up for the meal that we had lost. So eating in moderation is a health-promoting tool which we can imbibe during Ramadan, from the Ramadan fast. Now, when we abstain from fluids for 12 to 15 hours, the duration that the fast generally lasts, depending on where in the world we are located, this has not been found to have any bad effect on our health. In fact, studies have shown that the mild dehydration and water conservation induced during the fasting period improves longevity in cells. So Islam is a natural religion, and nothing is omitted therefrom. Allah that created us knows our body physiology, and He has not therefore asked us to do dry fasting, water fasting, juice fasting, 24-hour fasting, or any other type of fasting that will not allow us have sahur and iftar. Allah recognizes the fact that there's a minimum requirement for normal functioning, a minimum dietary requirement for normal body functioning. Wherein, if we go below this minimum, there'll be a breakdown of the body stores of nutrients, and this will lead to wasting. An individual will lose weight, and it may actually suffer from other health issues. To ensure that our health is sustained, Allah thus permits pregnant women, the elderly, the sick, breastfeeding women, and so on, to stay off fasting, as mentioned in Quran chapter 2, verse 185, where, which I cited earlier, where Allah says, but if anyone is ill or on a journey, the prescribed period should be made up by days later, that is outside Ramadan, after the pregnancy, after the illness, or whatever ailment, or even after the journey. But there's some people who, even after Ramadan, will still be unable to make up for the missed fast. Allah allows us to do what is called fidya, that is to feed an indigent fasting person daily throughout the month of Ramadan. This will stand instead of the Ramadan fasting. So although the fast of Ramadan is compulsory, it is however not something that is detrimental to our health. It's not something that you have to do so that you end up committing suicide. If you're pregnant and you cannot cope, you're breastfeeding and you cannot cope, you're ill and you cannot cope, Allah has given us a leeway. Fasting in the month of Ramadan leads to a decline in the incidence of sexually transmitted diseases. Uninterestingly, it would appear as though a number of people do patronize the brothels outside Ramadan, Muslims and non-Muslims alike. And they shun this act during the holy month of Ramadan, whether they're Muslims or they are not. This is not surprising, because the Prophet ﷺ said, when the month of Ramadan starts, the gates of the heavens are opened, and the gates of hell are closed, and the devils are chained. So it would seem that everybody is wanting to benefit from the gates of paradise that have been opened during this month. Hence, they no longer visit the brothels, and therefore sexually transmitted diseases, which may also be include hepatitis, gonorrhea, herpes, HIV/AIDS, and which may lead to such complications as infertility and shortened lifespan. All these are reduced because of Ramadan. Now, alcohol. Fasting encourages many Muslims who still engage in alcohol consumption to abstain from it permanently. Although Allah Almighty has categorically forbidden the consumption of alcohol for Muslims, some people still find it difficult to quit this deadly habit. Allah knows our body composition and knows what is good for it. And this is one of the reasons why He says, they ask you about intoxicants and gambling. Say, in them is great sin and some benefit for men, but the sin is greater than the profit. This we find in Quran chapter 2, verse 219. So, well, we use alcohol-based solutions to wipe our hands, to clean surfaces, but for drinking, for taking in, Allah says the sin, the disadvantage is greater than the benefit. Again, Allah says, "O you who believe, intoxicants and gambling and divination by arrows are an abomination of Shaitan's handiwork. Excuse such abomination that you may prosper." So in spite of this, some people still find it very difficult to abstain from alcohol. But during Ramadan fasting, because they know that if they were to take alcohol, their fast would not be acceptable to Allah, they abstain from alcohol during this period, and this has made remarkable improvement on the various diseases that alcohol predisposes one to. alcohol has been reported to be associated with hypertension, atherosclerosis, diabetes mellitus, some cancers, and so on. In fact, in pregnant women, when they continue to imbibe alcohol, or if they had been imbibing alcohol before the pregnancy and they did not know early on, it results in increased abortions, what lay people would call miscarriages. And so she keeps getting pregnant and keeps losing those pregnancies. If she carries babies to term, she would have low birth weight babies. Some babies will also suffer from alcohol baby syndrome and so on because they've been intoxicated even during pregnancy. So when individuals fast and they are unable to consume alcohol, at least for this 1 month, it is hoped that they would benefit from this 1 month of avoidance and continue to live a healthy life outside of Ramadan. Fasting in Ramadan also provides tobacco smokers a reason to stop smoking, okay? And smoking, the problem with smoking is that it's not only the person that smokes that suffers from smoking. In fact, those people around him who undergo secondary smoking, they inhale their smoke, they actually tend to suffer more than the actual smoker. And we do know that cigarette smoking predisposes to cancers of the tongue, of the lungs, may lead to bronchitis, may lead to peptic ulcer. It could lead to a host of things, which is worse in the fetus, in the baby that cannot leave the room, okay? The wife of the smoking man can leave the room, but the baby of the smoking woman cannot leave the room. The child is just there in the uterus and imbibing all the smoke. So with Ramadan, when the person decides to fast in Ramadan, this will take care of smoking for that 1 month, and we hope that if the person continues to abstain from smoking outside of Ramadan, this would have been a health benefit that will be long-lasting. Ramadan fasting, of course, also helps us to lose fat, to lose weight. A lot of people are obese. They have their body mass index greater than 30 kilograms per square meter of body surface area. And therefore, when they fast and they do it properly, some of them are able to lose some of this fat. So obesity reduces in Muslims following the month of Ramadan. And if, like I said earlier, if we use it as a health promotion tool to eat in moderation, then the body weight can be kept within normal limits. The Prophet ﷺ said, a believer eats in one intestine, that is, he is satisfied with a little food, whereas an unbeliever or a hypocrite eats in 7 intestines, that is, he eats too much. So as Muslims are encouraged to eat very little, just eat what we need. This is a health promotion activity. Now, an overall improvement in cardiovascular risk parameters have also been reported. Fasting reduces blood glucose level, reduces cholesterol, reduces systolic blood pressure. That's when you measure your blood pressure and they say, well, it's 120/40. The one on top, that's 120, that's the systolic blood pressure. And when we do Ramadan fasting properly, this reduces after Ramadan. So Ramadan fasting, therefore, can be used as a form of treatment for moderate to mild to moderate diabetes mellitus, obesity, and hypertension, because we do know that obesity too can be mild, can be moderate, can be morbid. We've seen people who, their body mass index is way beyond 30 kilograms per square meter. So they suffer from morbid obesity and all the things that surround that, but that is not today's lecture. Now, in a study from my lab, which I published in 2016, we reported reduced body mass index, BMI. A lot of you know about BMI, following 4 weeks of the Ramadan fast in young, healthy adults. From the same study, we also reported reduced systolic and diastolic blood pressure hyperreactivity to autonomic stress in the same group of individuals. Hyperreactivity, systolic blood pressure hyperactivity or diastolic hyperactivity. These have been found to be indicators of the development of strokes in later life. So if one were to engage in Ramadan fasting and to also maybe go on later after Ramadan to do the Monday and Thursday fasting, you'd find that this could actually help reduce the risk of developing strokes later in life. Now, another researcher, Mazidi and his colleagues in 2014 reported that Ramadan fasting alters lipid profile by improving the HDL, that's high density lipoprotein cholesterol, that's a good cholesterol, and reducing the bad cholesterol, bad in quotes, that's LDL cholesterol, in some of the patients that they examined. Now, along with hypertension, smoking and others, abnormal lipid profile is a risk factor for developing strokes and atherosclerotic heart diseases. So if you do not want to have heart attack, Ramadan fasting is an endeavor that can protect us against this. Similarly, Nemati and his colleagues in 2012 reported a significant improvement in 10 years coronary heart disease as heart attack, risk score, and other cardiovascular risk factors, such as lipid profile, systolic blood pressure, again, that blood pressure on top, when we say 130/72, weight, BMI, waist circumference, in people with a previous history of cardiovascular disease. So what we are all saying is that when we undertake the Ramadan fasting, it's not just a spiritual exercise, okay? It does not just bring down body weight, it brings down the body mass index, which is important in some of the diseases we're talking about. It modifies our lipid profile, our cholesterol. Some of you have been going to your doctors to ask about your cholesterol, and then they give you medications and tell you to modify your diet and all that. So Ramadan fasting is one of the things, one of the health benefits of Ramadan fasting is that it actually improves our lipid profile, okay? And it does also reduces our risk of developing strokes. Now, does it have any effect, Ramadan fasting have any effect on our nervous system? Ramadan fasting, which is a form of intermittent fasting, helps to nourish the nervous system and to enhance brain function. There's increased production of a protein, which is called brain-derived neurotrophic factor, but just know that it's a protein, it's an opioid, which is involved in the activation of brain stem cells and their subsequent conversion into new healthy neurons. Ramadan fasting also helps to protect the brain cells by the production of some of the proteins. It protects brain cells from degenerative changes that are commonly associated with the central nervous system. You've all heard about, well, I expect that some of us have heard about Alzheimer's disease. We've heard about Parkinson's disease. We all know Muhammad Ali, the world-acclaimed boxer. He suffered from Parkinson's disease. So one of the things that the Ramadan fasting can do for us is to nourish our neuronal cells and reduce our propensity for developing such diseases. Now, on our skin, when you see people who fast, you see their skin glowing. The acne, the pimples on their face and other parts of the skin go down. Other inflammatory issues of the skin are also taken care of by Ramadan. This is because during Ramadan, a lot of us modify our diet to become healthier. We eat less of processed foods. Even when we attend the meetings where they will give us processed foods, we do not eat them because we're fasting. So our meals contain more of fruits and vegetables, which are good and refreshing for the skin. Now, when we perform salat in Ramadan, you all know that we go to the mosque at night. Were it not for this COVID, We would be out at night performing the Taraweeh, what the Yorubas call Ashamu. We would go there, we would perform at least 8 rakats, sometimes 10. If you go to Saudi, it's 20 rakats. The more rakats that we perform in excess of our normal 22 compulsory rakats in a day of a compulsory salat, the more we lose calories. But it's been reported that for each unit of salat, for each rakah, we lose 10 calories. So imagine you lose 10 calories for each one. You do 22, which is compulsory. You add another 20 during the day and at night. You see how many calories that we lose just from performing more salat in Ramadan. And we only do this in Ramadan. So it's one of the benefits of Ramadan fasting. Now, mental health. Ramadan fasting breeds unity in the family and peace among people. It brings peace and tranquility, reducing stress and stress-associated conditions such as hypertension, peptic ulcer disease, bronchial asthma, because some people will have their asthma attack because of stress. Anxiety disorders, psychosis, and some other psychiatric disorders are also reduced during the Ramadan fast. This is because the Prophet ﷺ advised us that if anyone slanders or assaults you, what do you say? Do you respond? No. What to do is say, I am fasting, I'm fasting. So you've not only told that person, I'm not going to respond to you, I'm not going to react to your hostilities because I am fasting. And at that time also, you have reminded yourself that you are fasting. And when you're fasting, you know that you must be peaceful. Ramadan is one of the holy months in Islam in which hostilities are not allowed. So even when somebody assaults you or does anything that normally would anger you, you would say, I'm fasting, and then you move away. So the Prophet again said, Allah is not in need of someone's abstinence from eating and drinking, while at the same time he is involved in lying and carrying out falsehood. And you know, when you lie, it opens the door for greater evils. So you don't want to lie, you don't want to engage in any evil, you want to benefit from the gates of paradise that are open in Ramadan, and therefore you maintain peace and there is reduced hostility amongst mankind. So when we're fasting, we attain a state of mental tranquility and self-satisfaction. Again, fasting induces deep sleep, which also improves our mental status. During Ramadan fasting, substances are released, opioids actually, are released from the nervous system, such as enkephalins, endorphins, and these are responsible for the feeling of well-being that the fasting Muslim has. So you feel tranquil, you are happy with yourself, you're satisfied with yourself, you want to extend that to the next person. So this is part of a health benefit and of course social benefit of Ramadan. So again, fasting reduces the rate of road traffic accident. We all know that road rage is one of the greatest causes of road traffic accidents. And since in Ramadan, we are encouraged to exercise patience and to develop self-restraint, road rage is reduced, and therefore a lot of lives are saving just from saying, I am fasting, I am fasting. In closing, some personal hygiene, because growing up, especially in the Yoruba environment, people would translate fasting to our way. And some people now took it to mean way, that is not having your bath. Okay? This is not part of Ramadan fasting. The Prophet ﷺ said, Allah is pure, and he will not accept anything other than that which is pure. So having a shower, even if it is to reduce the pangs of a fast, is allowed. So on the afternoon of Ramadan, if you feel it's too hot or you're feeling it too much, you're still allowed and encouraged to shower. Because as I said earlier, Ramadan is not to punish us, it's only to take us nearer to Allah. So anything that will make us be healthy in Ramadan is actually encouraged. How about cleaning of the mouth? Again, growing up, Children, for example, would, say they're fasting and then they would go somewhere and eat or drink and then clean their mouth. But that's children. Eventually they will learn, okay? Now, some people will say, no, when you're fasting, you're not supposed to brush your teeth, you're not supposed to use the chewing stick. That is not part of Islam and is actually not part of Ramadan fasting. The Prophet ﷺ said, wait not for the fact that I do not want to create an inconvenience for my ummah, that's for the Muslims, I will have mandated them to use the siwak, that's the chewing stick, before they perform every salat. Okay? We all know that when we fast, we do less talking, we do not eat, we do not drink. So saliva, which is supposed to move around the bacteria in our mouth and move it away, it doesn't do that as much as outside fasting. So the mouth will develop a sort of physiological odor. It's physiological because there's nothing, there's no disease causing it. The only thing is that we are fasting, okay? So you do not want to disturb your neighbor, you don't want to disturb your colleagues in the office or anywhere. You therefore are encouraged to cleanse your mouth. So the International Committee of Health and Ramadan that held its Congress in Casablanca in 1994 opened our eyes to various improvements in the health of people who fast intermittently in the month of Ramadan. I have provided some of the information from that conference. I've provided work from my lab and from labs of colleagues who have thereafter been working on the Ramadan fast and its effect on our health. If the lessons learned during Ramadan, whether in terms of dietary intake or righteousness, are carried on outside of Ramadan throughout the remaining 11 months, it will be beneficial for our entire life. Remember, Ramadan fasting is actually a health promotion tool, one which we all try to imbibe and which we should carry on for as long as we are able. I thank the organizers again for inviting me. I thank you all for your patience and I appreciate your attention.
Jazakumullahu khairan, ma. Thank you very much, ma, for that very inspiring and educative lecture. We appreciate you, ma, and pray for you during this period. Thank you very much, ma.
Hello, good afternoon, everyone. Thank you again for joining us. And pardon the itches that we've had so far. Yeah, the tip that we want to talk about is how to navigate our life, because now we know that COVID has come and it's as if it's not going to leave any soon. So it's better we start planning on how to continue to live with COVID. So as we all know, by now, we should all know that COVID is a pandemic which originated from or started from China. The first case was reported in China. And by now, as of today, over 4.6 million people are infected worldwide, and over 301,000 persons are already dead. In Nigeria, 5,621 persons are currently infected, and it has spread across all states, almost all states in Nigeria, with about 176 deaths. So we know, but it's good that we also remind ourselves that any person can be infected by this virus, However, elderly persons and those with other diseases or whose immunity is depressed are more vulnerable or are likely to die from it. The symptoms include, but not limited to, because this is an evolving disease that we really don't know so much about yet. So people come up with cough, dry cough, fever, sore throat, difficulty with breathing, body aches and pains, and extreme fatigue. Yes, at the earliest stage when it started, we were talking about history of recent travel or contact with positive person. Now that what we have is community spread, there is nothing like history of contact, history of travel again. And because also a lot of patients are asymptomatic. So you can be sitting with someone in the bus or someone in the office who has it and you don't know. So as at date, there is no definite drug, no vaccine. Research still ongoing. But the important thing is when you notice anything, you are expected to report. And self-medication is discouraged. So the purpose of this talk is, for us, we know that our government had instituted lockdown, but it's obvious that this cannot go on for too long. The reality is that we will have to live with COVID for some time. So this short talk is how we will continue to exist and carry out our activities, our daily routines without getting exposed to COVID. So tip 1, of all the tips, of all measures, the safest of them is staying at home. And so as much as possible, if we can work from home using whatever technology, we should. Virtual meetings and lectures, we can shop online and ask whatever it is that we want to be delivered at home. We should also try to reduce social and physical human interaction. And it is a must that we get face masks, several of them, and sanitizers for every member of our family. In addition to having sanitizers at home, we should have it in our car, we should have it in our office, we should have small ones, in our pockets or bags as we go out. So tip 2 is about transportation. The safest option now is to drive your own car, but if you cannot drive your own car, then you enter public transport with caution. When entering public transport, we should avoid overcrowded car or bus. It is a must that we wear a face mask and use hand sanitizer, or wash our hands with soap and water for at least 20 seconds as soon as we're out of the bus or car. And for those of us that use Uber or Taxify or any other, it's best to sit at the owner's corner where you don't sit directly behind the driver. The third is the tip at home. Sorry, I'm told you're not seeing my screen. So at the office, we should adopt using shifts. In fact, we should decide which of our staff will be able to work from home permanently and ask such staff to stay at home and work. And for the others, we should have a roster so that people will work in shifts so we don't have overcrowded offices. When going to the office or going around, we should also avoid touching railings and other objects along the corridor. When using toilets, bathrooms, elevators, we should take special precautions. And we should have either tissue paper or wipes already soaked in alcohol ready. So we can use that to, clean door or push buttons of toilets to wipe before we use them. And I've already mentioned we should avoid overcrowded office. Sharing items like, oh, can I use your pen? Can I say, use somebody else's phone and so on? We should avoid this. And on our table, we should avoid putting all our items like a key, phone, and so on the table. So that they don't get contaminated. And of course, we must use this alcohol soaked tissue paper or wipe to clean our table or chair and all the surfaces, first of all, when we get to the office. And then any item that we put on the table, we must clean them before putting them in our bags. This is very important. In the mall or market, as much as possible, we should for women that need to go to the market, there are a lot of people that are ready to do home deliveries now. So we should acquire clients that have their number and call them, can you supply me with tatarodo or tatache? And they will be there, to do that for us instead of having to go to the market. Have a list ready so you don't have to wander around. And so the aim is to spend minimal time and reduce human interaction. And like I said, I must emphasize again that we have alcohol soap, wipe or tissue or cotton ready to wipe surfaces of items that we have gone to buy as soon as we get home and, use to clean. Now, if we have to go to the restaurant to eat, this should be avoided as much as possible. Eating in should be avoided. We should rather do takeaway or home delivery and avoid sharing pens and other items at the restaurant. Avoid overcrowding while waiting and use wipes to clean surfaces of items once inside the car. When we're back at home, we should clean the door handle and dispose the face mask. There are some, if we use disposable face mask, you should dispose completely. Cotton face masks that are now being sold, we should just drop immediately into our laundry basket. We should not reuse it. It should only be used once. Otherwise, it's likely to bring some infection. And then wash our hands with soap and water, wipe surfaces of items, and then remove all clothing that we put on and put in a laundry basket. If possible, shower before getting settled down at home, because you never know what your clothing or your dress will have taken with it inside somebody's chair, car, or in the bus and so on. So the general prevention: wash your hands frequently with soap and running water for at least 20 seconds. Let's not be tired of washing our hands. We should keep washing our hands every now and then. If we don't have water around, like I said, we should have sanitizer in our bags, sanitizer in our cars, sanitizer at home, sanitizer in the office. And we should avoid touching eyes, nose, or mouth with unwashed hands. So finally, when we know of someone that is sick, that has fever or dry cough, we should stay away from such person and, ask such person to go to the appropriate health facility. And whoever is coughing should cover nose and mouth with tissue immediately and cough inside your elbow. The safest is to stay at home. So stay home safely. FAJIM says, hand in hand, together we can eradicate COVID. Thank you very much.
Moving on to questions. If we have anyone that has questions, we have, you can write your questions down in the chat area, or you can ask or raise your hand, ask, and then we'll give you access. We'll unmute you so that you can ask your questions. You can just raise your hand in the on the application or type your questions. Walaikum salam wa barakatuh, sir.
Okay, can I ask my question now, please?
Yes, you may.
All right, so let me first of all thank the FAJIM Foundation, Medicare Foundation for this very good program. Allah make the organization to keep on growing and impacting lives. And I also want to commend our professor, guest lecturer today as usual. It's displayed dexterity. May Allah continue to enhance our knowledge and wisdom.
Amen.
So my question to the prof is, we've seen all the very beautiful things that, we gain during the month of Ramadan, basically regarding health. But all of these gains come because of the certain practices that we embark upon during Ramadan. So the question is, what are the ways that we can really behave post-Ramadan to continue to practice some of the some of the practices of Ramadan that will make us to keep on being in the excellent state of health that we always experience during Ramadan? Thank you.
Can I take the question or we wait for others?
Yes, ma, please do.
Okay, thank you. I'd like to thank our father for that question. As always, he would push you and make you more responsive. You have to know what you're talking about when you're talking to Alaji Tunde Pokola. Thank you so much, sir. Now, outside Ramadan, the things that we can do, just like I said, the lessons that we've learned in Ramadan should be carried out outside Ramadan. One of the things that we can do, for those of us who are Muslims, we know that we still have fasts, different fasts throughout the year, just not as intense as in Ramadan fasting. Okay, so we need to partake as much as possible in the intermittent fasting, which I mentioned earlier, Mondays and Thursdays as 2 days in a week. There's also the fasting of the 13th, 14th, and 15th day of the Islamic month. There's a fasting of the different months of Rajab and Shaban. Okay, so all these intermittent fastings have been recorded scientifically to actually improve our well-being, our health, just almost as much as Ramadan fasting does. What do we do when we fast? Moderate eating. Okay, moderation in eating. That does not stop with Ramadan. A Muslim does not fill his stomach at any time. And that was why I kept saying Ramadan fasting is actually a health promotion too. When we eat moderately, we ourselves will feel it in our body. One, we will not gain weight, we will not be lethargic, we will feel good with ourselves. We will feel good, we'll appreciate the food, the fact that we have food, we appreciate God Almighty. When we do that, we have this tranquil feeling. Okay, so we do everything to moderation. Those people who take alcohol or who smoke tobacco or who use other substance, this is a time, this Ramadan is a time for them to stop. For you to have been able to stop for 30 days, 29 or 30 days, do not see outside Ramadan as a time to go crazy or a time to go back to what you had done. Continue with the lessons that you had learned in Ramadan, okay? Leave off tobacco. It doesn't give anything good to you. It's as if you're using your money to buy death. And in fact, I like the tobacco industry. They put it on a big disclaimer on the packages of their cigarettes or their tobacco products. You are likely to die young. Tobacco or cigarette smoking reduces life and all that. So they put it there. These people can see. And people are actually moving to e-cigarettes now. They think that is not as bad as cigarette smoking. It's actually worse. It's actually worse, but it's not the topic for today. So let's, all the lessons that we learned about eating, about feeding, about not filling our vessels, about, you know, if you can say to somebody who aggravates you in Ramadan, if you can say, I am fasting, and that brings down your aggro. Why can you not do that outside of Ramadan? When people try to annoy you, just think in your mind, take yourself back to that feeling of satisfaction, of tranquility that you have in Ramadan when you say, I'm fasting. You may even not be fasting on that day, but tell yourself, I am fasting. Okay? And that brings you down. The Prophet ﷺ teaches us that when you are annoyed while standing up, try to sit down. When you're annoyed while sitting down, lie down. Okay? By the time you keep changing posture, eventually your anger will be going down. So once you make up your mind you're not going to be annoyed, you find that your mental state will always be better than when you allow yourself to be aggravated. So all these are some of the things that we can continue to do outside Ramadan to ensure that we maintain our health. And when we were growing up, our parents and people generally used to think that when you're fat, when you're obese, that shows is a sign of healthy living. We know today that if you are obese, if you are overweight, talk less of being obese, you are actually doing a lot of damage to your heart, you are doing a lot of damage to other organs in your body, and you do not want to do that. So you do not want to eat to become obese. You want to eat to stay alive, to be healthy, to be able to carry out your activities. All right, so these are some of the things. And of course, personal hygiene, that is not debatable. Personal hygiene is not debatable. Allah is pure. He will not take anything from us except that which is pure. You cannot approach Salat. You want to talk to God in Salat and you are dirty. Your mouth is smelling. You've not had your shower in days. You've not had, your clothes is dirty. No. So Islam preaches personal hygiene every time and all the time. I hope I've answered some of your questions in part, sir. Hello.
Thank you, ma'am, for the.
Prof. You are Prof. Thank you so much.
Thank you, sir.
Thank you very much, ma'am. Okay, we have one or two comments from the chat area. First of which is a comment about self-medication. The person says self-medicating has claimed lots of lives. They want to implore FAJIM to add this when giving talks, especially to uneducated people. Maybe our professor can give a comment on that.
Yes.
Yes, absolutely. Okay. Prof, please go on.
We have taken note of that. We do that every now and then when we go for outreach programs, and we're going to continue to do it. Thank you very much, Alaji Agbayemi, for that comment.
Thank you, Ma. Another question is, how can we manage ourselves so that we don't feel dizzy during the day? Because most of my friends tend to sleep during the day, Ma.
Okay, that's a very interesting question, because a lot of people think that when you fast, you have to sleep during the day. That's not part of our lives as Muslims. Okay, the training in Islam is that you do not sleep after Fajr, after the Subh prayer. When you sleep between Subh prayer and Zuhr, then it shows you don't have anything to do. Now, no thanks to COVID, most of us end up, having too much time on our hands now. But in reality, when you fast and you eat moderately during Sahur, you will not feel lethargic. Because as I explained earlier, it is when people overeat during Sahur that because the intestines have to work on that food and they need energy to do that work. So the intestines will, collect energy, so to speak, from all parts of the body, and that person begins to feel drowsy and tired, and he wants to sleep. So the first thing is not to eat too much during Sahur. Eat adequately, okay? And eat what is good. Eat food that will last for long, okay? There's some long-lasting food, high fiber foods that you can eat. Avoid foods rich in sugars, okay? Eat whole meat foods, whole wheat foods. Eat foods that are rich in content, in fiber. For example, sweet potato has more fiber than Irish potato. Although some of us do like Irish potato more, but you understand, it has more fiber. Add vegetables to your food. Eat beans, eat lentils, stuff like that. Don't just take white bread or take food that, some people will just say, oh, I'll just take a bottle of fizzy drink, and that's all. When you do that, the body gets rid of that within 3 to 4 hours. But when you take food that will last long, it takes like 8 hours before you begin to feel the pangs and that you feel tired or you want to sleep, if your reason for sleeping is not that you ate too much, okay? So then you need also to find time to rest during the day, so that now, especially in the last 10 days, I'm not contradicting myself, I'm saying Ramadan during the day is not meant for sleep. But if you need to sleep between Zuhr and Asri, especially now that we are in lockdown, you are allowed, even religiously, to take a nap between Zuhr and Asr. And then when you do your night vigil, the tahajjud that we do, especially these last 10 nights, you don't want to spend the entire night. Even the Prophet ﷺ said, it is best for us to use, the Quran says, it is best for us to use part of the night, okay? And the Prophet ﷺ says, the last third of the night is even better. So let's try and target the last third, or if you think you have more energy, maybe half of the night. But don't spend the entire night standing up in prayers, not because it's not good to pray, but because it's going to, you have to pay back during the day. And if we're to be going to work now, if not for the lockdown, you know that it's going to affect either you, affect you in school or affect you at work. And Ramadan fasting is not supposed to do that. Okay? In fact, you should be most agile during Ramadan fasting. Thank you.
Well, in absence of any other person having questions, I have questions of my own, Ma.
Okay.
Okay, the first one is, for a person that has consistent ulcer pains and is not, I don't know how advisable it is to be popping or using drugs in the morning and at night to manage the ulcer. How exactly is the person supposed to manage it instead of using drugs in the morning before meal and then using drug again in the evening?
Okay.
Okay, let me just ask all the questions that I have.
You have so many. Go on.
The second question, Ma, is for for non-Muslims now. Should we now advise them to fast? Non-Muslims that have like hypertension and diabetes, because you said we are saying now that fasting is beneficial to us. So is it beneficial to non-Muslims too that have this high blood pressure, hypertension, diabetes, and all these other ailments? And then lastly, well, I heard a lecture about this recently about how we are supposed to perform Eid during this period, and I'm not quite clear on that. If Professor Abdulkareem can shed more light on that for those of us that might not know.
Okay. So shall I go first, Prof?
Yes, ma'am.
Okay. For the person that has peptic ulcer disease, and it's so bad that he can not do without his medication, as I said earlier, Allah does not want any disadvantage for us. So Ramadan fasting is not about, it is compulsory, but it is not something that is compulsory for everybody under every circumstance. So Allah has said, if you are ill, leave off fasting. So this person has to genuinely know that he cannot fast. His doctors would even sometimes have told him, no, you must always eat. You understand? So he knows that if he fasts, and we've seen patients like that, who because of the love they have for Allah and for wanting the rewards in Ramadan, would force themselves to fast, and they would end up almost dying. Okay? So Ramadan fast is not meant to lead anybody to the graves. We don't want to be Prof Abdulkareem's clients yet. Okay? So this person will leave off fasting, and he will make up for the fasting by feeding an indigent fasting Muslim. Okay, so it will give the person sufficient food for sahur and for iftar daily for the entire 29 or 30-day period. So for such person and other people who have other diseases that prevent them from fasting, somebody is just recovering from a surgery, somebody is just being treated for cancer, other things like that, which will make them not able to fast. Even healthy people who just suffers malaria for a few days during Ramadan, he's not expected to fast and kill himself, because that would be considered suicide, which is not acceptable in Islam. So you would leave off fasting, feed, if you know that permanently you will not be able to repeat the fast, you feed the person, fasting is a Muslim during Ramadan. But if you know that you might be able to fast, like a menstruating woman, or a woman who's just given birth, or who is suckling a child, who is pregnant, then you would leave off fasting and make up for it later in days outside of Ramadan. That make it easy for us. Now, with all these beautiful things that we say, all these benefits that Ramadan fast does have for Muslims, or for people who partake in it, we to advise our non-Muslim friends to partake in Ramadan fast? Interesting, question. But the simple answer is no. Ramadan fast, as Allah says in the first, in the ayah that I cited when we began, when I said, why do Muslims fast? Quran chapter 2, verse 183. Allah says, O ye who believe, fasting has been ordained for you. The fasting of Ramadan is for Muslims. However, I did also mention that there are so many different types of fast. which look like the Ramadan fast, and which have also been investigated and been found to have some form of health benefits. Okay, the intermittent twice a week fasting, as long as the days of fasting are not following one another, you could decide to fast Tuesdays and Thursdays, okay, or follow what Muslims do Mondays and Thursdays. As long as we're fasting twice a week, we will still have the health benefits of an intermittent fast. You could also do alternate day fasting, okay? So these two types of fasting, alternate day fasting or twice a week fasting, are quite beneficial. What I do not know about and what I cannot recommend are the types of juice fasting, water fasting, overnight fasting, because overnight fasting is as good as not fasting. You sleep, when you sleep, nobody eats. But interestingly, it does serve some people's purpose, okay? But I do not know the scientific benefits of that as yet. But I know the scientific benefit of twice a day fasting and alternate day fasting. So we can recommend that for our friends. But if they fast in Ramadan, maybe if they're just used to fasting, but they cannot say it is Ramadan fasting, because Ramadan fasting is only for Muslims. Thank you.
Thank you very much, Jazakumullah khairan. So we have a comment stroke question.
No, you had a question for Prof Abdulkareem about Eid.
About Eid, I'm not Ustaz. We've been told, our learned Ustaz have said that we can, yes, we won't pray Eid, but we can, it's nafila, you know, so we can do it in our homes, our family. Immediately after sunrise, we can do it just to Nawafil with Takbir, the first rakat 7 times and the second rakat 5 times. So even if we are not going out, we remember COVID, we're not going out to take our family out. We should stay home and enjoy, cook delicious meals that are healthy and enjoy ourselves within our homes. Allah protect us.
Thank you very much, Ma. We have one more comment here. The person says that I know of a devout Muslim who stays with a Christian family. During the Ramadan fast, she would collect and keep every food they eat. So when the fast is over for the day, the person would eat everything together. What can one say to that person?
Well, you know, I said earlier that Ramadan fast is, as Allah says, for us to learn self-restraint. It is not about making up for missed lunch or missed snacks. No, it is about learning self-restraint. So even if you live in an environment where they would have lunch and have snacks and midday course, you need to move your eyes away from that. Yours for Ramadan is sahur and iftar. And even at those times, you're not supposed to eat heavily as though, oh, everything I miss, I must eat. That is not the way of Muslims. Yes, people tend to think the Ramadan is about food. Interestingly, this is a month about fast. It's a month about fasting, but people tend to make it about food and end up with a lot of wastages. You cook so many courses of food that they cannot finish. And the people outside in our neighborhood, in our villages, people who cannot have even a little thing to eat, who we should have sent the food to. Okay? I mean, this Ramadan is not about food. So this Muslim who lives with a non-Muslim should let them even see the beauty of Islam in the way he or she behaves. Let them know, because I'll be fasting, please do not make my lunch. Because I'll be fasting, I would not need anything at tea time. Okay? So all I need from you is my sahur and my iftar. That's the beauty of Islam, and it's the beauty of Ramadan fasting. May Allah assist us.
Amin, Ma. Thank you very much, Ma. We've come to the end of the program, but before we close off, we will have the vote of thanks. That would be done by the Secretary to the Board of Trustees of FAJIM Medicare Foundation in the name of Dr. Ibrahim Abdulkareem.
Okay. Assalamu alaikum.
Welcome, salam.
First, we would like to thank Allah who has made today's discourse possible. I did gain a lot, and I'm sure all the participants did as well. We do appreciate the participants for bearing with which is sincerely appropriate. We look forward to having you in future events. We also want to thank, or I thank our speakers, Prof Simiat Elias, and our founder, Professor Fatimah Abdulkareem, for inspiring lectures, inspiring and educative lectures. May Allah increase in knowledge and wisdom and answer your prayers in this glorious month. We thank FAJIM Medicare Foundation, as well as our scholars and all those who have contributed in making today's discourse a success. Lastly, I would like to appreciate our donors and sponsors who have not stopped supporting our main drive, which is to educate the undeserved community. For a hand in hand, together we can. Assalamu alaikum.
Thank you very much. Thank you all. This was not perfect, but alhamdulillah, we have learned, and we hope we all have all benefited from this, and we will all reap all the benefits of this blessed month. Thank you very much for your participation.
Thank you.